Hey everybody, welcome to this lecture on cardiac anatomy for the USMLE Step 1 exam. First, let's start by discussing the chambers of the heart. The heart has 4 chambers, the left and right atria and the left and right ventricles. The atria are the smaller upper chambers of the heart and are responsible for receiving blood from the body and pumping it to the ventricles. The ventricles are the larger, lower chambers of the heart and are responsible for pumping blood out of the heart to the rest of the body. Specifically, the right atrium receives deoxygenated blood from the superior vena cava, inferior vena cava, and coronary sinus and pumps that blood into the right ventricle. The right ventricle takes that deoxygenated blood and pumps it through the pulmonary arteries and into the lungs where it is oxygenated. The left atrium receives the oxygenated blood from the lungs via the pulmonary veins before moving the blood along into the left ventricle. The left ventricle is responsible for pumping oxygenated blood out to the rest of the body as well as to the heart itself. Now, let's talk about the valves of the heart. There are 4 valves in the heart: the tricuspid valve, the pulmonary valve, the mitral valve, and the aortic valve. The tricuspid valve is located between the right atrium and the right ventricle and prevents backflow of blood from the right ventricle to the right atrium. The pulmonary valve is located between the right ventricle and the pulmonary artery and prevents backflow of blood from the pulmonary artery to the right ventricle. The mitral valve is located between the left atrium and the left ventricle and prevents backflow of blood from the left ventricle to the left atrium. The aortic valve is located between the left ventricle and the aorta and prevents backflow of blood from the aorta to the left ventricle. Now, let's discuss the anatomical positioning of the heart. The heart is located in the mediastinum, which is the central compartment of the thoracic cavity between the lungs. The heart is tilted slightly to the left and is oriented so that the left side is more superior than the right. The heart is also divided into an anterior, inferior, and posterior aspect. The anterior aspect of the heart faces the sternum, and the inferior aspect faces the diaphragm. The posterior aspect of the heart faces the vertebral column. It is worth remembering that the right ventricle takes up the majority of the anterior aspect of the heart. Next, let's talk about the vascular supply of the heart. The coronary arteries are the main arteries that supply the heart with oxygenated blood. The coronary circulation is divided into 2 main branches, the right coronary artery and the left coronary artery. The right coronary artery arises from the aorta and supplies the right atrium, right ventricle, and the inferior portion of the left ventricle. In 80 to 90% of people, the posterior descending artery arises from the right coronary artery. However, in the rest of the population, it is a derivative of the left coronary artery. The left coronary artery arises from the aorta and supplies the left atrium, left ventricle, and the posterior and inferior aspects of the interventricular septum. The major branches of the left coronary artery are the left anterior descending artery, which is the most common site of myocardial infarctions, and the left circumflex artery. In addition to the coronary arteries, the heart is also supported by the coronary veins, which drain deoxygenated blood from the heart muscle back into the right atrium. The coronary veins include the small cardiac veins, which drain the myocardium, and the great cardiac vein, which drains the interventricular septum. The heart has 3 layers: the endocardium, myocardium, and epicardium. The endocardium is the innermost layer and lines the chambers of the heart and the heart valves. It is composed of endothelial cells and a thin layer of connective tissue. The myocardium is the middle layer and is responsible for the contraction of the heart muscle. It is composed of cardiac muscle cells and a thick layer of connective tissue. The epicardium, also known as the pericardium, is the outermost layer and covers the surface of the heart. It is composed of a layer of mesothelial cells and a thin layer of connective tissue. It has both a visceral and parietal side, with the visceral side contacting the surface of the heart itself and the parietal side contacting the structures adjacent to the heart. It is a double-layered sac that surrounds the heart and provides it with support and protection. The space between the 2 layers of the pericardium is called the pericardial space and contains a small amount of lubricating pericardial fluid that reduces friction as the heart moves within the mediastinal space. Finally, there is a fibrous pericardium external to and attaching directly to the parietal pericardium. The fibrous pericardium also attaches to the sternum and great vessels. Finally, let's discuss the electrical signaling structures of the heart. The heart has its own intrinsic electrical system, which is responsible for coordinating the contraction of the heart muscle. The main electrical signaling structures of the heart include the sinoatrial node, the atrioventricular node, the bundle of His, and the Purkinje fibers. The sinoatrial node is located in the right atrium and serves as the primary pacemaker of the heart. The atrioventricular node is located in the interatrial septum and serves as the relay station between the atria and the ventricles. The bundle of His is a group of fibers that carry electrical impulses from the atrioventricular node to the ventricles. The Purkinje fibers are a network of fibers that spread the electrical impulses throughout the ventricular muscle, coordinating their contraction. In summary, the heart has 4 chambers: the left and right atria and the left and right ventricles. The main vessels of the heart include the aorta, vena cava, pulmonary artery, and pulmonary vein. The heart has 4 valves: the tricuspid, pulmonary, mitral, and aortic valves, which prevent backflow of blood within the heart. The heart is located in the mediastinum and is supplied by the coronary arteries. The heart's intrinsic electrical system is responsible for coordinating the contraction of the heart muscle and includes the sinoatrial node, atrioventricular node, bundle of His, left and right bundle branches, and Purkinje fibers. I hope this lecture on cardiac anatomy was helpful for your USMLE Step 1 exam preparation. Thank you for listening.